Good evening, colleagues. Welcome to another installment of the AI webinar series. I hope you are learning a lot and are keen to start using and experimenting with more and more AI tools beyond just using ChatGPT. My name is Dr. Caroline Lee. I will be your moderator for this evening. I am an anesthetist by profession with a profound interest in healthcare worker wellness and the future sustainability of South African healthcare, as are all our members of FOSHI, the Future of South African Healthcare Incorporated. This webinar is a passion project and is brought to you by the collaboration of Africa Telehealth Collaboration, the South African Medical Association, the South African Private Practice Forum, and the Alliance of South African Independent Practitioners Associations with FOSHI. Before we start, there's just a few housekeeping messages. This webinar is accredited with 2 ethics CPD points. Certificates can take 3 to 4 weeks, so please be patient. After that, queries can be sent to cpd@discovery.co.za. The webinar will be made available on the Africa Telehealth Collaboration website. The links will be pasted in the chat if you can see it. As a result of the significant interest in this topic, the registrations have way exceeded our Zoom capacity. If you didn't get onto the Zoom platform, you can watch this on YouTube. If you're watching on YouTube, please click on the link provided underneath the video to get your CPD points. If you don't do it, you will not get your CPD points. So please remember to do that. The link is underneath the video. It is important that you share the correct HPCSA number as well as the relevant prefix such as the MP or the OT or the PT, etc., to allow for timeous and correct allocation of the CPD points. We will have time for Q&A at the end of the presentations. So please ask your questions in the Q&A section. Please make it relevant to these presentations. You will have a chance to ask other unrelated AI questions in the poll at the end of the webinar. We will then plan further webinars around them. Okay, so let's get to the exciting part. The poll after the last webinar indicated that most of you want practical demonstrations of AI tools in action. How do I get started today? So we listened, and today we're presenting you with 3 useful AI tools which can transform your day-to-day life and your practice. Hopefully, it will reduce the time spent on administration burden, help you transform your practice into a digital one, help with extra information for decision-making, and give back time to spend on patient care, which we are trained for and has meaning to us, as well as time to spend on our life outside of work. We are privileged today to have 3 entrepreneurs providing tools within the South African context, showcasing their product. Please note that our organizations are not endorsing these particular products as there are many available on the market. We are presenting them as examples of tools that can be used immediately within your practice. The first presentation is by Mr. Eli Tubiana, the CEO of ScribeMD. ScribeMD is a leading AI medical scribe company used by physicians across the US and Canada and is at present the largest AI scribe platform in South Africa. It aims to help reduce administration burden, which is one of the leading causes of physician burnout. It is HIPAA and SOC2 Type 2 compliant. Over to you, Eli.
All right. Thank you very much for the time and the opportunity. I'm really excited to share about ScribeMD and to show you how to use it on a day-to-day basis. So let me share my screen very quick. There we go. All right. So I'm going to go quickly over what ScribeMD is. And really, the goal is to focus on practical example on how you can use ScribeMD today. But just super quickly, the company is a bit over 2 years old. And today we have over 20,000 doctors that are using ScribeMD on a daily basis. These doctors are all over the world. We are a company based in the US, in California, but we also have now offices and partners in South Africa. And one thing that I wanted to mention super quickly, so if you're not familiar with AI Scribe, we are the only one who run an AI Scribe study in the context of South Africa. In our use case, it was in the emergency room. And what we did is we followed doctor and patients for over 2,000 visits using an AI medical scribe, in our case, ScribeMD. And we just got 3 takeaways, and those I think are the 3 reasons, if I need to give you any reason why you need help to write your note. Those are 3 main ones. The first one, obviously, clinician can save a ton of time. So as you all probably know, clinician can spend hours a day just writing notes. So what we've noticed is in the context of the ER, clinician can save an hour per day, which is obviously massive. It had a really positive impact on medical burnout. As you all know, medical burnout is a huge issue in South Africa. And so kind of reducing the amount of work also reduces the amount of stress for the clinicians. And the third takeaway I wanted to share with you, that I think is the most interesting, is what's in it for the patient. What we've noticed is when a doctor using an ambient AI scribe, meaning there's an AI that listens to the conversation and can write the summary for the doctor, what happens is not only the doctor is happier, but often the patient is happier. Because we've all been in that situation where you walk into the room and you talk to a doctor and the doctor is typing on their computer and you're like, hey, I'm here. So with a solution like ScribeMD, you can finally just kind of put your computer away and kind of focus on your patient. And when you're done with the conversation with the patient, then you have a fully ready medical note that you can start editing and putting into your system. One last thing, I guess 2 last things before I jump into the demonstration. So right now I'm going to show you how to use it on a computer. One thing I wanted to mention that's very important is you can use ScribeMD on essentially anything that has a microphone. So we have mobile iOS and Android application. We also have a tablet application. We have a web application I'm going to show you. We even built our own hardware that's available for purchase, which is essentially like a little microphone that you can clip on your white coat. And when you start talking to a patient, you press a button. You stop talking to a patient, you press another button. You wait around 20 seconds and you have your note fully generated for you. And one last thing I wanted to mention, I'm sorry, I'm long before doing the demonstration, but I think it's essential, is we do only medical conversations, meaning that we are extremely focused on compliance and security. Obviously, like you're going to be recording either medical information and sometimes even medical conversation between you and your patient. And we know how much you and your patient care about your privacy. And this is like, we really kind of follow all the gold standard in terms of keeping your data safe and protected. And also one thing I should mention that I think is really important is we never hold your data long-term, meaning that as soon as the conversation is done, we destroy the conversation and delete it so that there's no risk of it, like no compliance risk on your side.
Eli, sorry to interrupt. We need you to put your presentation on slideshow mode.
Oh, here we go.
Yeah, thank you.
But I'm actually just done with the presentation. I was about to jump into the demonstration. All right, can you see my screen okay? I think it's good. So, okay, I'm going to show you in this example, essentially there are 2 ways you can use ScribeMD. What ScribeMD does is it listens to the conversation between you and your patient, and then it generates a note. Something that's really relevant in the South African market is we can listen to the conversation in English, but also the conversation can be in Afrikaans or even in Zulu. And we're working on adding even more languages. So here you obviously choose the language. Very important, you can pick a template. So we have a list of over 1,000 templates of medical notes that have been curated by doctors from our end. So for instance, if you want like a pediatric template, or if you want like a psychiatric note template, you can either build your own or you can use one of the templates that we've already built for you. Here you can pull in patient details if you want to, but I'm just going to jump into a quick demo, and in advance, I apologize for the terrible acting skill, but stay with me for a minute. So I'm going to start the consultation. Try again. Here we go. Okay, so let's say here, let's pretend I'm coming to the doctor today with a cough, and I've been really feeling under the weather. And also, if you take my temperature is 40 degrees. And maybe at this point, the recommendation of the doctor is to take ibuprofen 500 milligrams 3 times a day. And also, we're going to administer a COVID test. Oh, by the way, actually, the patient maybe now remembers, actually, I took a COVID test yesterday, and you're right, it was positive. And maybe I'll do a quick physical exam. The patient is, like you seem like you also like, you look really red, and you are sweating profusely. And maybe we'll schedule a follow-up in 2 weeks. And also, if you experience any shortness of breath or dizziness, make sure that you call emergency services. So you see, as I was talking to the patient on the left-hand side, he was live transcribing my conversation with the patient. And on the right-hand side, he was just kind of giving me a few pointers around, live pointers around kind of like the things that I wanted to touch on with the patient. Obviously, everything you're seeing here is fully customizable. So I'm going to press Generate Note. Can take a few seconds. So you see, after a few seconds, you see a note that's fully generated. So chief complaint cough. So patient present with a cough, reports a positive COVID-19 test taken yesterday. And vitals, assessment, plan. And here, that's my personal note. That's the note the note template I built for myself. We even have a patient note, right? So kind of like a summary of the conversation that I had between the patient, but in more, not in medical terms. Two things I wanted to quickly show you. So here we have something called scribeMD. And essentially this is ChatGPT, but with the context of the conversation with the patient. So you can say, for instance, I want the ICD-10 code for this patient, or I want to create an excuse for work letter for this patient. So I'm going to try, what is the ICD-10 code for this patient? So it can take a few seconds, but it's actually going to pull the ICD-10 code, display them to me, and here we go. So U07.1 for COVID-19. So also one more thing I wanted to show you specifically about the South African market. The issue that you probably see is when you're done, this is great. You can go ahead and you can edit your note here. You can copy and paste it into your software. But one thing that we've been working on is also spending quite a bit of time integrating with practice management software and EHR software. I wanted to show you a quick example of also another way you can use ScribeMD. So here I'm going to jump into Health ID. So if you use Discovery, you're probably familiar with it. And this last piece is still a work in progress, but I really wanted to show you how your workflow can be improved here. So let's say I have a new patient and I'm going to start a consultation. All right, it's an in-person consultation, great. So here, there are two things you can do with ScribeMD that I think are really interesting. The first thing is, you'll see here on the right-hand side, if you install the ScribeMD module, you'll get this little like icon, and you can press on the microphone and start dictating your note, which is pretty useful. So you can say, patient is a 28-year-old male presenting with pain in the left abdomen. Great. So you see, don't have to type anything, even understands the French accent, which is terrific. But another thing that you can do, which I think is really useful, is you can see a list of all your past visits that you've done on ScribeMD. You can select one, and here you see there's a button that says Send to Health ID, and you will essentially copy all your notes directly into Health ID. And so the Health ID part is still in beta, and it's not available for everyone. But I just wanted to show you kind of our goal is to really make sure we embed into your workflows so that you can leverage AI efficiently and we can reduce the number of clicks. Jumping back to the presentation, so as I told you, so we're working on custom EMR workflows, especially in South Africa. We're always looking to support and test additional languages. So as I told you, we work with over 100 languages, and including, so obviously English, Afrikaans, and Zulu, and we're always looking to add more languages. So if you contact us at contact@scribemd.ai and you have a specific language that you would want to support, we'd be happy to try to support it. In the case of hospital, usually we work also with hospitals, we can build a pretty robust reporting and help hospitals kind of keep track of usage and make sure that people are leveraging AI properly. And finally, obviously, like industry gold standard for security and compliance. All right, before I hand off the microphone, two things I wanted to tell you. So the good news is ScribeMD is actually entirely free to try. So you can go to scribemd.ai, SCRIBEMD.ai, and you can use it for free. You can test it out, and also you'll see if you're interested, and there's a few premium feature that you cannot access. You can use this discount code Discovery, all caps Discovery3, and you'll get 3 months of a premium account on ScribeMD. Finally, if you have any question or if we can be helpful in any way, you can contact us at contact@scribemd.ai. All right, back to you, Dr. Lee.
Thank you, Eli. The questions that we have now, we will ask at the end, okay? So we will go on to our next speaker. But before we do that, please note that if you are on the actual Zoom platform, you don't need to put your name and your CPD and your MP number in the chat, because if you are on our Zoom platform, it's automatically recorded from your registration detail. It's only the people on YouTube that needs to click on the link for their CPD points, okay? All right, so our next speaker is Dr. Yassine Khan. Dr. Khan is the CEO and co-founder of EMGuidance. He is a South African medical doctor with a master's degree in clinical epidemiology and a diploma in primary emergency care, as well as a technology entrepreneur. EMGuidance is the largest digital platform in South Africa, which provides locally relevant clinical, educational, and prescribing solutions across the healthcare ecosystem. It is the official mobile platform for the South African Department of Health National Standard Treatment Guidelines. Dr. Khan is pioneering AI-enhanced clinical decision-making tailored to the South African healthcare context. Let us hear from him what his platform has on offer. Yassine, over to you.
Great, Dr. Caroline, thank you very much. I'd just like to note I'm unable to activate my video. It indicates that the host needs to provide permission. So kindly just guide me if I should proceed or whether I should do that. There we go. Thank you. Thank you very much. And I should be sharing my screen. Great. Good evening, everybody. It's a fantastic pleasure to be speaking to you. Thank you to the organizers. This evening, I will be talking to you about EMGuidance. Very many of you may be quite familiar with the platform. I'm going to be focusing on some of the later features as well as where we're going from an AI perspective. So looking very much forward to it. So to kick off, EMGuidance is a mission-driven organization. It is a clinical platform, an ecosystem. And the mission of EMGuidance is really to empower the front line of healthcare delivery, to empower healthcare professionals to ultimately deliver optimal care in the South African context. And as many of you will be aware, the model for EMGuidance is very much to aggregate and centralize locally relevant clinical information, practical information, and ultimately around that to provide a highly functional clinical technology platform that includes things like smart referencing, smart clinical tools, digital prescription, e-learning and CPD as well, and more including care coordination and very practical care coordination and ecosystem related information to drive very precise patient care within both the public sector and the private sector. So I'll be going through these things one by one. So kicking off on the guideline side, this has been very much a mainstay of EMGuidance for many years. EMGuidance guidelines are aggregated from official trusted parties such as the National Department of Health, professional societies, medical universities, and many of you again will be familiar with this very basic capability. We keep the guidelines up to date. We digitize them in a user-friendly mobile manner. And as you can see, you can cleverly search for a particular guideline and find what's relevant for your region. On the medicine side, again, this is a very commonplace use of EMGuidance. The medicines resource within EMGuidance is highly comprehensive and up to date. It is consistently being updated. And what's important about it is the medicines data is evidence-based. Each data point is referenced, and it's overseen by a specialist pharmacology team, and ultimately is a localized set of medicine information that is based on an international set of data, but localized for SAPRA-approved package inserts, as well as National Department of Health Standard Treatment Guidelines. But what we also do is integrate a number of key local data sources. For example, the AfriTox poisons information and management of toxicology is available through the EMGuidance medicines resource. In addition, the national pricing database. So every price of every drug is available through EMGuidance. And our goal is really to create a kind of democracy around medicines information, such that access and affordability to medicines is just open and free for every healthcare professional. So this is overseen by a specialist team. Many of you will see the chat and support function in the app as well. There's a very direct and transparent engagement with the EMGuidance team. And so we often have very kind of academic engagements around the content. And so it's very live and scientific environment. So that's just a little bit about what sits behind the content. And again, on screen, what you will see is a simple demonstration. What's important to know about this, many of you will use this on a day-to-day basis. The EMGuidance database gets a search every second to second and a half. So it's highly, highly used in and around the country. I just need to switch my light back on, apologies. I'm sure some of you couldn't see me there for a second. What you'll see on screen is the fact that the medicines information within EMGuidance also contains some special calculators and tools. So precise dosing and just adding a lot more precision to every last potential medicine decision is being integrated into the EMGuidance medicine database. Moving on, aside from the medicines and information segments of the platform, EMGuidance has a growing clinical calculator and decision tool area. Now, many of you would have seen this in the platform. And what you'll note is that there are over 500 standard medical scoring calculators. But in addition, we have a growing range of South African specific clinical scoring systems. So we work with healthcare organizations, medical specialists, and as we go on, we create specific decision tools. So for example, for nurses, there is what we call a vaccine catch-up calculator. If a child has missed a vaccine, for example, as happened in COVID, we've worked with local specialists, and there's a simple tool that assists the nurse to figure out exactly how and when the vaccine schedule needs to be recalculated. So I encourage you all to have a look at those. A really exciting area of the platform as well. Then digital prescription. So because of EMGuidance's strength and leadership in terms of medicines information, and it's worth noting the medicines data in the platform is used in pharmacology training in medical schools around the country. It's also used in pharmacy schools. And hence, because of the scientific nature of the medicines data, it became quite important for EMGuidance to develop a smart digital prescription. This is available on mobile, it's available on web. And importantly, the way we do the prescription is that it can be done from your phone, but on the web and from the mobile, it can be fully integrated with your practice system. So EMGuidance, for many of you who use practice systems, electronic health records, you'll note that EMGuidance is now fully integrated. For all VeriClaim users, for example, EMGuidance is not only fully integrated, but it's fully paid for. But it's integrated across GoodX as well. And those of you using the CGM products, so quite across board in your EMR and practice systems, you'll find the EMGuidance script integrated. It's also fully integrated with pharmacy systems nationally, so Clicks, Dischem, and the various independent pharmacies. But the important bit is that what we really bring to the market is a smart medicines prescription from a pharmacology perspective. So all the various rules, drug interactions, pricing, and more clinical rules, and more integrating medical scheme information, co-funding, co-payment information, etc., is really where we're going. The goal of EMGuidance is always clinical, and it's always about providing the best local answer through clever technology. So that's on the prescription side. The Academy formally was launched about 1.5 years ago. EMGuidance is now definitely the largest provider of online CPD for doctors in South Africa. There were about 500,000 CPD interactions just this year, up to date. And what the Academy really is, it takes the EMGuidance collaborative model. So what we do is we aggregate and partner with medical institutions from around the country. So there are now over 50 partners. That includes medical universities, higher learning institutions, and even leading specialists who provide learning on the EMGuidance platform. And that basket of learning, which is growing consistently, we make available to the EMGuidance audience. What we do is we have a personalization algorithm and system such that you will see and get recommended content that is relevant to your profile and more relevant to your use of the platform. So the Academy, what it also does is it's got a full CPD tracking capability. So we manage your certificates. We've got a very close relationship with the Healthcare Professionals Council from a technical perspective. So you do your CPD on EMGuidance and can have it updated at the HPCSA. And so I encourage everybody to have a look at that as well. And then importantly, on the care coordination side, empowering healthcare professionals to make the right decision is really incomplete without providing the right practical information and the right care coordination information. And it's not complete without the ability to connect healthcare professionals with each other. So what you'll find, and this is a more recent development, EMGuidance has launched a directory and referral capability focused on the private sector. And what it does is it integrates medical scheme co-payment information. This is something that is very dear to your patients' pockets. It's a major cost driver in South Africa, where patients pay out of pocket when they land at non-network facilities and hospitals. And it also drives a cost at medical schemes, which are contributing to overall cost of healthcare. And what we've done is assisted healthcare providers by having schemes upload network information. So you can search for a particular specialist, you can select a medical scheme, and you are then able to, obviously on the basis of your location, search and find practitioners as well as facilities. And ideally you want the right practitioner and facility on the network. And then as you can see on screen, there's a direct messaging capability as well. The messaging capability is going to go live in October. For the first time, the 115,000 healthcare professionals on EMGuidance are going to have the ability on the same platform to message each other and connect with each other without hindrance. So it's the first time such a large network exists where there is no barrier to contacting any other healthcare professional. It's part of our drive to enable an improvement in healthcare by connecting healthcare professionals to each other. So watch out for that as well. And then lastly, in terms of your own input into this, aside from integrating medical scheme and hospital information, you are able to utilize the EMGuidance profile and account system to do three things. To one, track your CPD profile. Two, to facilitate a more personalized experience in the platform. But three, to also make certain information about your services public, so that when other healthcare professionals are searching for the right specialist or the right referral capability, referral center, they can see that. So you can actually contribute information into the platform as well. So where's all of this going? EMGuidance has hired a AI engineering team, and it is hard at work taking the EMGuidance database, working with clinical specialists, and a governance framework to ensure that we can provide a South African relevant, AI-driven and natural language clinical assistant. The same experience that you've been having for many, many years with EMGuidance, but now in a safe and trusted AI-driven basis. And essentially what we are doing is integrating not only the EMGuidance clinical data, but more and more medical scheme information, care coordination information, and ultimately comparatively to the frontier models such as ChatGPT, what problem are we really solving here? Many of you will be familiar that the Healthcare Professionals Council recently launched their AI guidelines for healthcare providers. It's important to familiarize yourself with that. The risk and the medical legal risk really sits squarely with you as the practitioner. And there are certain principles in those guidelines. For example, that whatever answer you get from a clinical system, an AI-driven clinical system, really does need to be reproducible. You also need to be able to communicate to the patient the evidence and the sort of rationality for how you achieve the result. So what we are doing is really working on the basis of trusted sources and official sources. And just to take you on a little bit behind the scenes, we are working and optimizing the system such that the areas of control that we have, particularly around when we get a natural language question from an individual, how do we ensure, to direct to the right document and guideline, particularly when they are black and white questions and when they are more sort of open and gray questions, and where can we not give an answer, because that's also important. And then making sure that when calculations and particularly smart tools are used, that it's a defined and local specialist approved set of tools. And also building in the relevant safety guardrails, as well as audit and evidence trails. So that's what we're busy with currently. This is likely to be live before the end of the year. And what's important is that you'll get that in the EMGuidance app, but to our partners as well, practice systems, record systems, dispensing systems will also be able to feed in the EMGuidance sort of AI-driven system. So to close off the presentation, importantly, we know that there are not only healthcare professionals on this webinar. EMGuidance is mostly free for healthcare providers, guidelines, medicines. The prescription is a paid-for product, and some of the e-learning is paid for directly. But we work very closely with other practice systems that can integrate the technology. More and more, we're working with medical schemes to drive integration of scheme, care coordination, formulary, referral information. Hospitals are also able to use the platform, particularly to keep employees and nurses, allied healthcare professionals, to keep them compliant and to drive training. And pharmaceuticals will sponsor, for example, CPD accredited webinars in the platform, always on a very disclosed and transparent and rules basis. And to close off, in terms of EMGuidance's uptake, I mentioned that many of you will be familiar with the platform. What's fantastic is that there is a search of EMGuidance nearly every second. It is now in every town, city, hospital, clinic around the country. It is the vast majority of healthcare professionals. We estimate over 75 to 80% of practicing doctors, a growing number of nurses as well on the platform. And importantly, the platform has been recently government gazetted as a mandatory resource in every pharmacy, really by virtue of the essential medicines list and medicines information within the platform. And of course, close working relationship with the National Department of Health to digitize the national standard treatment guidelines. There's also a growing range of academic partners. So if there are academic and institutional partners on the call, we have a process for this. We welcome engagements, but a growing range of academic partners, practice system, hospital partners, pharmacy partners, and of course, e-learning partners on the platform. So in closing, EMGuidance is very much about improving healthcare outcomes, and as you can see, reducing the overall cost of care and driving outcomes at a national level throughout South Africa, and working with partners to enable to do that and leveraging the scale of its platform to do so. So it's really a collaborative exercise. Ultimately, we seek to take the work that we've done over the last couple of years and leverage the technology of the day, AI, and take the same vision into the future. And as I mentioned, we can really only do this with everyone's support. So I encourage you to look at the platform, look at the participatory components, particularly the profiling area. As users, have a look, provide feedback to us. And if any healthcare stakeholders on the call, please feel free to reach out to me for engagements. Thank you very much.
Thank you, Dr. Yassine. Okay, so our last presentation today is by Mr. Louis Da Silva. He's the CEO and co-founder of Healthbridge. Louis is a passionate leader at the intersection of healthcare and technology. He holds a BSc in electrical engineering and an MBA from Wits University. He brings together 20 years of experience in innovative health tech solutions and industrial automation projects, from designing solutions to writing software in industries as diverse as car manufacturing and breweries. Wow. He aims to help practices transform from paper to digital, adopting cloud and electronic medical records, as well as transforming practice workflow, using AI assistance, and many more uses. I will let him show you himself. Louis, over to you.
Thank you very much, Caroline. Thank you for the opportunity. Great. I think you can see my screen. Good evening, everyone. Fantastic to be here. And I hope that you'll find the few slides and the demonstration instructive. Before we start, I'm very mindful that we're close to 7:45, after no doubt a long day. So as a kickoff, I thought I'd share with you an interesting little joke that one of our clients shared with me just a few days ago related to AI. I think this will resonate. And yeah, perhaps that's the way to get everybody to lower the lifestyle-related diseases, given the first half of that bubble. But on a more serious note, what really is the benefit of AI in practice? Not in the future, but what's actually happening today is really what I want to cover. And from our perspective, we see 4 dimensions. The impact it has on quality of care, on time of you as a healthcare professional, on income, and lastly, on contract performance, which more and more is going to be a consideration given the new dawn of discussions like value-based care and so on and so forth. And what I'd like to demonstrate to you today is an electronic health record called Healthbridge Clinical. This electronic health record has had doctor clients treat over 2 million patients in the last 12 months through this electronic health record. It's also recorded 60,000 ambient AI listening consults in the last 2 months, in fact. And what we'll do, as directed by Caroline, is let's make this real in practice and see how can AI be leveraged today. So what you see here is Healthbridge Clinical. I now have logged on as a doctor. I can see, in fact, that we have an appointment lined up, Anele, in the next few minutes. We are running a little bit well ahead of schedule. you'll see that there are options for regular consults, medical insurance, telephonic, video consults, and so on. And in fact, already in the waiting room, Anelia has checked in, and we can begin to treat her. So by clicking on her as the next patient, the electronic record, the yellow digital file, if you like, opens for Anelia. There's some talking points. I see she's a social media influencer, so on and so forth. And there's a whole bunch of other functions you can see on the left, together with the timeline of her patient record. Now, the first touch point that AI can help me is to view a summary of Anelia. And what the AI does is look into the depth of Anelia's clinical record and give me a quick snapshot to get a picture of Anelia before I start in the consult. Typically, I'll see 20 to 25 patients a day. I serve a community of maybe a few thousand. So who exactly is Anelia? How do I, to use the technical term, I'm an engineer, apologies, how do I load Anelia into RAM? So here AI has gone in, and immediately I get a quick summary, 37-year-old female. Yeah, I can see a bit of post-long COVID, a bit of respiratory infections. It also highlights to me some screening and prevention opportunities based on her particular record. And in fact, a couple of potential care gaps based, for example, on certain chronic conditions and so on and so forth. And if I really want to, I can scroll down and look at further details. But at this point in time, I have a good picture of who Anelia is, and I can start the consult with her. So I can close that. I'm going to begin the consult. And we are not going to be repetitive between the presenters. You can see my little microphone there. That's where I would do the ambient listening. But this time I'm going to use a different function just to create a quick consult. Anelia, with all the respiratory problems, is back with the cold and flu. I'll ask her how many days. She says it's been 3 days. Her throat is sore. She doesn't have any sinus pressure. She's got a wet cough. At least the sputum is clear. She's headachy. She's got body ache. She's got fever, and so on and so forth. Depending on the symptoms, the right questions pop up. I can then do an examination, and again, this would have been picked up in ambient listening, but in this particular case, I'm just going to type it quickly. So her temperature was sitting at 38. Her pulse rate, let's say, was a bit high, 83. And yeah, SpO2, not great. Let's call it 90 in this particular case. And so in the end, unfortunately, I come to the point where I diagnose Anelia once again with influenza. And this influenza is of respiratory manifestations, given a history. I can now go to the medicines, the machine learning immediately understanding the ICD-10 suggests some medicines for this particular condition. In the interest of time, I'm just going to accept the azithromycin and the prednisone. We now come to the next touch point of AI, which is what do we do going forward with Anelia, given her respiratory issues and once again the influenza coming up. And in this particular case, I'm going to choose to actually refer her using the AI referral mechanism, and we're going to refer her to a pulmonologist. So I simply just type in pulmonologist. And what the medical grade AI, we use Google's Med Gemini, does, it goes through the depth of Anelia's medical history, understanding that the referral is to be done to a pulmonologist, and will prepare text, which afterwards you will see I can edit under my control, but a referral letter, a draft of a referral letter for Anelia to be sent to the pulmonologist. This does take a little bit of a while because there's a few large language models keeping each other honest. One gives a solution, the other one double checks and questions it. But nevertheless, here you see the referral. You're seeing Anelia, 37-year-old, evaluation of a persistent respiratory symptoms, recurring chest infections, lung disease, and in fact, the long COVID. It then gives a history of what's happened. It notes that on the 18th of July, spirometry findings, where we picked up that in fact her lung function was reduced, the fact that she had long COVID, and her list of medications, including the ones that we just did, and everything else behind it. From there, I can choose to copy this to my letterhead. I can choose to email it, and that'll pop up. I'm going to email this to Dr. Pulmonologist, and also maybe in this case, I actually want to send a copy to Anele as a backup. And I'll send it, and it's done. Again, a note, a referral letter of that kind of depth would have taken a long time for a doctor to prepare in a complicated case such as that. So that's the second touch point where AI is practical. And I'd like to demonstrate and share with you two more. I'm going to save this consult, and let's finish it. We'll close down the history and the patient. Just saving it. There we go. Let's go back to Anele, because the next thing we would like to do is, in fact, by the way, you can see there's the recording we just did. Anele's gone home. She's a bit worried. And what we can offer is a visit summary for Anele, which she will receive, that summarizes the consult that just happened, the medicines that she's been given, and something that you can keep with her because maybe she's been a bit overwhelmed and might come back with questions and so on. So there you can see, it was good to see you. We talked about your flu symptoms. Here's what we're going to do. There's your zithromath. There are the instructions, so on and so forth. And now what we can do through agentic AI is, in fact, link this to Anele's WhatsApp message and send it through to her for her to look at and keep with her whenever she needs. In the background, agentic AI, one agent speaks to WhatsApp. We have a clinical agent. We have an administration agent that handles things like bookings and so on. And then we also have a billing agent, which will come shortly to aid with collections and so on. And so if I go to Anele's WhatsApp and I look at her phone and she clicks on there, in fact, this was the message beforehand that spoke about confirming Anele's appointment at 7:45 today. Very much like your Fly Sapphire experience, but you'll see now that Dr. Healthbridge, being me, has an important update. This is a channel, importantly, on behalf of the practice, so to be Dr. whoever your name is. I've just chosen to do that. When Anele is in her own time, she can, in a private space, when she's ready to look at the message, she can ask to show the message. And what will come through is, in fact, the summary that as a doctor, you approved that the AI drafted to say, as we saw in the electronic health record, the update, the details on the medications, the next steps, and so forth, and so on. So that's an important touch point. And the third one that I'd like to show you. Let's close Anele's file. And the last, or the fourth touch point I would like to show you is the ability to interpret pathology results. So Prithvi is listed here. By the way, that is the outcome of ambient listening. Much as you saw earlier, the SOAP assessment was chosen here and done. But if we go back in Prithvi's timeline, you'll see that after a certain appointment, some path results came in. These are real-world path results. They've been anonymized, but this is a real one that's come through. We've just pasted Prithvi's name on here for now. And there's the normal path results as one would know and expect. What AI now does, as the fourth touch point to illustrate, is it, on the left-hand panel, provides a clinical opinion to the healthcare professional. Again, an opinion. So it's read the path result. You remember there was a lot of different parameters. Here's the HbA1c. In fact, if you want to click, it's gone through the medical record, collected other HbA1cs to get a quick glance of what's happened to that particular metric. There's the fasting glucose. No surprises, you see a couple of reds there. The LDL has also got a bit progressively worse, it looks like. And then at the bottom, it summarizes the key parameters. So the patient's latest results show a critical increase in markers for diabetes control and other concerning trends when compared to previous tests. The current HbA1c you see is 10.9, where in October it was 7.9. The glucose has gone very high, LDL, so on and so forth. There's also some comments around the PSA and the EFGR. So in the end, the clinical opinion of Google's MedGemini is Mr. Ramnachan is a type 2 diabetic, and he's showing a pattern of suboptimally controlled diabetes and cholesterol. The primary clinical concern is the patient's severely uncontrolled diabetes, evidenced by the HbA1c going up to 10.9, the glucose 14.7. And it carries on to say, of secondary concern, the LDL has gone up to 4.1. There's a rising PSA, which is now borderline. Just keep an eye on the EFGR, the kidneys, and this might be as a result of the poor glycemic control. The last thing it also makes a note of is, look, the B12 is also a little bit borderline, which might be as a result of the long-term metformin use. And again, this came out from the knowledge of MedGemini together with the depth and the history of this clinical patient, giving the doctor a quick, complete option. It also on the right-hand side for Prithvi, and this really addresses the tension between doctor and patient. Wow, I've had to have blood tests. I'm a bit worried. Obviously, things might not be good. Do I phone the doctor? Is the doctor going to phone me? The doctor needs to find a place, needs to review the results. Now it needs to be communicated. How do we do this? It's a bit of an awkward situation. So on the right-hand side, AI has again drafted a message. Hi, Prithvi, I've received your blood results. I want to talk you through the main points and our plan. The most important finding is that your blood sugar levels are very high, and that your fasting glucose is also significantly elevated. These high sugar levels are a serious concern. I need you to book an appointment to come see me as possible this week. You'll need to make significant adjustments to your medication, discuss your diet, lifestyle, and so on. Now, again, I can go change this. A bit of a nice message at the end. I know this can be unsettling, but please don't worry. We'll work together and create a plan. Again, I can now send this to Prithvi and send through the WhatsApp, which at the end of the day, you will, as per last time, it'll come through on the WhatsApp feed that we saw earlier. And there it comes through. In the interest of time, I'm not going to wait for the message, but the exact message you saw, it came through there. So that really is 4 quick touch points of AIs outside of scribing and medicine prescription that I thought would be valuable for you to see. A few other points, some lessons we've learned. And in fact, Dr. Caroline, I think you mentioned it up front. In talking to doctors don't want AI. And AI is not ChatGPT. That's not the job to be done. And when we've looked at it, we've come to learn that there are actually, it's about the load, the cognitive load on the healthcare professional. The most important cognitive load is what is known as intrinsic cognitive load. And that's the complexity, the brain power you have to apply to understand this patient's case complexity. What we don't want is in all these AIs and EHRs and clickety-clicks, and that's why ambient listening is so important, is to introduce an extraneous cognitive load, which is now going to navigate this EHR and AI tools and click here and so on and so forth. That's not helpful. And hopefully there's enough space to do what is known as germane cognitive load. From this experience with this patient, what can I learn and commit to my long-term memory that I can use for patients going forward? And so the way we see it is the job to be done is to lower the intrinsic load, certainly not introduce extraneous cognitive load, and to make space as a result for the germane or important cognitive load. Second learning is that AI is not for sissies. This is not a cool little cute trick with ChatGPT. This is an ever-evolving capability that we as Healthbridge have had to go through internally. There are ML ops, AI ops, Sec ops, the security side. These tools are changing. They need to be tuned. They need to be worked with great partners that can deliver the kind of quality that needs to be delivered. So in closing, the rows listed here are the different AI points that Healthbridge Clinical has got. The ones that have got the dots are the ones that we saw. We saw the patient engagement coming through to the WhatsApp. We saw the patient summary for the practitioner to load into RAM before treating the patient. We saw the pathology interpreter, the referral letter, and the patient summary that went back to the patient. And if one starts from the beginning of this presentation about the 4 dimensions, there's a very good overlap on how this addresses the quality of care, the time of you as a professional, impact, a positive impact on your income, and also really preparing you for more and more contract performance discussions over time. The last thing I want to leave you with is that there is a meaningful shift in the last 12 months. At a conference not too long ago, I presented this about 4 weeks ago. I did a mind map, a word map. Give me one word when you think about what comes to mind when thinking about AI in healthcare. These are the words came up. And yes, there's risky and there's need for caution. But the big ones are what started popping out. Helpful, future, exciting, scary, but interesting. And then when we asked for my practice, I'm very keen to use AI. I'm willing to consider AI. I'm already using AI. I'll never use AI. These were the numbers that came out. 48% keen, 32%, yeah, I'll give it a go, maybe. 30-16 say, hey, I'm already using, 4% never. With respect to these good doctors, this was not a young crowd. And that was what was especially enlightening. And lastly, maybe a bit of humor to end off. This we received yesterday from a doctor around our ambient listening, which over the last 2 months has taken about 60,000 consults. Unprompted, Dr. Olubi claimed he's undeclaring life for Nora, which is our Nora AI, our ambient listening. I told my wife already that she'd better up her game because Nora listens in bold, consultation made easy. And this is just a great heartwarming sentiment of, again, that shift that I've said that we've seen over the last 12 months amongst healthcare professionals. Thank you very much. I hope you found that insightful and interesting. Yeah, hopefully excited about trying AI yourself in whatever tool that you choose to. And as you see, there are many out there. Thank you.
Thank you, Louis. Thank you to all our esteemed speakers. We will now ask them to turn on their camera and turn on their microphone so we can ask some questions. But before we start, please take a few minutes at the end of the webinar to answer the poll. It will guide us to provide you with future webinars that are relevant to you. Okay, so there are quite a few questions coming through. The first few that are very easily answerable is that the questions can be, I think you've all answered that it can be adapted to all different languages. There's a whole language being sort of built into your platform. So the questions that are asked is that how many languages can you use? Can you speak in Afrikaans in the scribes and have it written in Afrikaans and posted in Afrikaans? Can you program it into that? The other one is that how adaptable is it? Can you customize it to a particular practice, such as for psychology practice, an allied healthcare practice, a dental practice, anything that's not medically related? Can you customize the platforms and to that? What about the codes that are used to medical aids? If you're not a medical code, what about psychology codes or psychiatry? Anything that's different. And The third question I want to ask, these are general questions. I'm going to give each of you about 5 minutes to answer these questions. So the first one is how customizable. Second is language. Can you use different languages? And the third one is what happens in a low network coverage, low connectivity area or rural areas? Can you still use them? Okay, let's start with these. Can we start with Ellie? Because Ellie started first.
There we go. All good questions. So if I take them in order, so numbers of languages that we support. So ScribeMD supports over 100 languages. In terms of South Africa, we support Afrikaans, Zulu, and also we support the notes being generated in over 100 languages. So essentially, you can have a conversation in Afrikaans and then write the note in English, or write the note in Afrikaans, and vice versa. You can have the conversation in English, write the note in Afrikaans if you want to. The second point, especially in the context of South Africa, I think is really important, is in terms of low coverage, so bad internet. A lot of the clinics that we work with have really bad internet connection. And so we have a fully offline mode. The app can be used entirely offline. The only thing is at the point where you want to generate the note, then we need to get some amount of connectivity. As a matter of fact, we even support third-party microphones. So what a lot of people do in the clinical setting is they have like a voice recorder that's like a piece of hardware, and whenever they get to their computer, they go ahead and drag and drop the audio file from the patient conversation or from their notes onto our software, and it will automatically create the note. And I guess the third one was about customization. So look, we've been doing like millions of transcription at this point. We have over 20,000 doctors who are assisting us on a daily basis. So it's like we've seen many notes, and one thing that I realized is how specific every doctor and every type of practice is with their notes. And we built from the ground up ScribeMD to be as customizable as possible. We have a series of sections. You can create as many sections as you want. You can use we support over 8 LLMs, so you can use like the OpenAI LLMs. You can use the Anthropic LLMs. We usually pick one for you, but you can change if you wish. And also you can create your own prompt, meaning you can tell the AI, hey, like I'll give you an example. My wife is an OBGYN, and one of our pet peeves when she started to use ScribeMD is she didn't like that we called her patient female because she felt like female is not very humanizing, and she rather use the word woman. So she could add that on her prompt. She said, hey, moving forward, can you use the word woman rather than female? And the AI picked that up and over time got better. And by the way, the question that you also ask here is for non-medical conversation. It's actually a really good point. One of a big use case for our software is recording also meetings between doctors. So between shifts or doing rounds, often doctor can record the conversation. They can go through each patient. They record this conversation with ScribeMD, and same thing, it can generate, you can customize the way you want to generate it, but it can generate a meeting summary, a discharge note for each patient, or really whatever you want. So we really, again, build it as customizable as possible. And we know that we call that prompt engineering. Not every doctor is like a prompt engineering expert. So we have over also 1,000 community notes that doctors on our platform created, and they shared with the community. So if you're looking for other doctors in South Africa that are building like a 3-month well child visit, you'll probably find that on the platform. And if I may ask also, if you can give back, and if you create a great note template, then you can just share it with the community. So that's how we build the platform.
Yassine?
I will speak to the point about language localization. I think that's most relevant on the EMGuidance front. Language is, of course, such a critical localizing aspect. Many of us, and I'm reflecting on my own personal experiences, I practiced and studied in the northern suburbs of the Western Cape, where the vast majority of our patient interactions were in Afrikaans. And similarly, around the country, that is the case. The challenge that we are looking at primarily at this stage is a safe repository of medical guidelines and scientific inputs and the clinical governance around that. That process is currently English, and the added work is really the medical terminology mapping between the official guidelines and trusted sources and other languages. And there's not always a direct match, and sometimes there's terminology missing. And so that's the challenge that we're working through currently. So very likely our first deployment, well, most certainly our first deployment will be in English, but it is a technical challenge that we are looking at. And it's a different technical challenge that I think the likes of the scribes and the practice systems will face, where it's more conversational. We are really looking at taking the underlying scientific data and putting that in every possible language. So it's something that is on our radar because of the importance with respect to localization, not only in South Africa, but beyond. And it's something that will come through in time.
Just to add on, EMGuidance is an app, right? Do you need connectivity to use it, or can you still use it in low network areas or rural areas?
So EMGuidance has been specifically designed such that you can use it offline and online, particularly in rural areas of South Africa where there are low coverage, low internet coverage and bandwidth. You'll note that there's a little toggle on the top for offline and online.
Okay. And Louis, I think that's how customizable is that for other practices other than a medical practice, because you've got all these terms and all these like drop downs and all these things for medical practice. Can they customize it to, say, for example, a physiotherapist, where they can say muscle strength or that type of thing, leg raise angle? Yeah.
Great. So let me try to address all three very quickly. Firstly, languages, currently English and Afrikaans. The default is it translates back into English. Google just 3 weeks ago announced that it is launching for the other 9 languages in our country. And so we expect in the next couple of weeks, we'll cover all official languages of our country. But the default is it does record back into English from the clinical note, at least at this stage. Customization perspective, so I think on 2 levels. So we do cover other specialities. We've got for physiotherapists, kind of body diagrams that you can, with a stylus, can make changes and so on and so forth. Currently, we cover general practitioners, consulting specialists, and auxiliaries. And we'll be moving into the surgical specialty shortly. And lastly, on the connectivity side, it does require connectivity, particularly when you want the translation of the ambient listening, but it is exceptionally light. That's the wonderful thing about these new technologies these days. The data burn rate, if you like, and the throughput is exceptionally low. So that we really haven't come across an issue at all across thousands of practices.
Thank you. So there's another general question. Patient and data privacy, data safety. Is it safe to have these patient data and identification details sitting in the cloud forever? How do you safeguard the privacy of that patient? And another thing is, are they consent forms, capability to ask for patient consent regarding sharing data? For example, on the EMGuidance, where you have care coordination and you want to share patient data, or how do you navigate this data privacy issue? I think let's start with Yassine, because you started about that care coordination and patient interaction between doctors.
No, thanks for the question. It's the ethical and legal principles around privacy are at the epicenter of all of this. It's important to understand the motivations behind the Papaya Act and what it's really trying to solve for. And the principles behind it are primarily around consent, number one, and purpose, number two. And what's also important is that, and we had to go through this, as I'm sure Ellie and Louis goes through this as well. The Act is a legal framework and doesn't really provide technical standards. So you've got to engineer around those principles. And that's what we're really trying to solve for. So from a consent and purpose perspective, we always have to ask ourselves, what is the purpose for us sharing a particular piece of information? And have we got consent to do that? So one will note, for example, in EMGuidance T's and C's, that EMGuidance is a system that the doctor uses. We don't have an interface with the patient. So we urge our users that should you engage, because we don't really have control over that interface, if you are sharing patient information, you commit legally that you've received the consent from the individual before you share it within the system. And so that's a legal matter. It's ticked within the T's and C's, and it's really the mechanism to do that. There are some very specific instances within the platform where patient consent is actually captured on the app. And those are for very specific functions. They're, for example, our clinical motivation function, where a motivation form for a particular reimbursement can be done through the application. And some of you will have that. There are specific legal or organizational, other process-related requirements where the consent is actually required from the patient, and the doctor can actually turn the phone to the patient and they can sign on the phone. So that functionality does exist, but we don't ordinarily do that where it's not required by law. And so that's generally from a Papaya legal and sort of ethical perspective. I think what we must separate is cybersecurity, right? Because protections of data from a technical perspective, and again, Louis and Ellie will have the same challenge here. We cannot take this seriously enough. Hacking and breaches are a commonplace occurrence. And so the level of investment, the level of specialization that is required is growing year by year. And just to take everyone under the hood there at a very high level, it is to the level of, and these are very standard matters, but standard penetration testing, even up to having what they call ethical hackers trying to access the system, and then benchmarking the various security protocols against international and local standards and producing a transparent report every year. So all organizations managing professional personal data ought to have those kind of reporting mechanisms and processes in place. EMGuidance is no different. We benchmark and rank extremely well from a cybersecurity perspective. So just kind of separating the two matters, making sure that from a legal, ethical perspective, our processes are above board, we manage our consents and purpose well, and then cybersecurity, that's a consistent and ongoing process.
A question for Louis. Who owns the data? So you have all these data that's been uploaded onto the cloud and all these patient summaries and so on. Can the patient, when they move practices, can they ask for the whole data, or is the data owned by the Healthbridge, or is it owned, who can ask for the data?
Very importantly, not Healthbridge. It is no different to the considerations between a practice and a patient on a yellow file, on a yellow paper file. Certainly, our software has got the functionality to export the data. We could have a healthcare professional that, for whatever reason, chooses to leave Healthbridge. And in that case, the data will go with the healthcare professional to the next system. And the conversation between the doctor and the patient around the patient's data ultimately is no different to what would have happened should I have a path lab result or something inside the yellow file of my doctor. So those considerations stay exactly the same. The ability to export it is certainly there at the doctor's will, together with the conversation for the patient.
So the doctor in the doctor's practice can choose to keep it on the cloud or keep them in their own private servers.
Okay, so that's important. And I wanted to touch on that point. Thank you, Caroline, for bringing that up. In Healthbridge's case, the data on behalf of the practitioner is in the Google Cloud. I would argue that these days the cloud is safer than a server at a practice, is certainly safer than files in a cabinet at the practice, even if it's locked away. We've had many cases where practices have been broken into, hard drives have been stolen, paper files have been stolen, there have been riots in the KZN where files have been lost in fires. And these cloud systems, and I'm not just punting Google, but it could be Microsoft, it could be AWS. Firstly, in Google's case, the areas of the cloud, if you like it, we use are completely healthcare HIPAA compliant and subscribe to all the standards of both in the US and the EU, which is far greater than, in fact, in South Africa. There is replication. It is the best chance of keeping your data safe and secure and not losing it. I would argue today on our planet is in the cloud, not on a dedicated server, certainly not on a desktop, on a PC at a practice, or inside that yellow folder.
So a question to all of you, but mainly Healthbridge, I think, because you're more a sort of like practice solution, right? Whereas ScribeMD can be used for a whole lot of other things, and EMGuidance more for knowledge and information, and obviously other uses as well. But from running a practice point of view, on Healthbridge, if you decide to change your service provider, that patient data, do you keep it? How can you transfer to another platform? What about interoperability?
Yeah, so those are great questions. And the second part is particularly a passionate area of mine personally. Firstly, as I mentioned earlier, should a client of ours ever choose to leave us, we will export the data in a way that's granular, that they can use to import into a different system. There is no industry standard, but we will provide the data in a spreadsheet or whatever form they choose for them to take with them. The real need in this industry is for interoperability between electronic health records. There's not a technical challenge to that. IT companies like the three here could get together and do that. It's not a technology challenge. There is certainly some legal implications. We get back to consent. The consent of, so even within Healthbridge, there could be two practitioners seeing Louis and they do not see each other's records because there's got to be a very specific consent process happening. So with the right legal framework in place to facilitate digital sharing with consent, then I believe the role players can get together, and it would be great if, when you go see a healthcare professional on a digital platform, no matter what platform it is, that there is a full longitudinal record of all the touch points that patient has had across all healthcare professionals. It is something that we are part of certain discussions and organizations to try and facilitate, but we need to go in with our eyes wide open from a legality perspective to protect the rights of the client. Yeah, personally, my job's not done until we achieve that as an industry, as a collective.
Yeah, I think that's a very important thing. I think interoperability, that word is very essential for healthcare, and I think we should all aim to work towards that. Okay, so this question is for Yassine and for Louis. It's regarding scripting. So both your platforms offer the ability to script directly to a pharmacy. How far can you go? I mean, can you script morphine or so Schedule 7 drugs, and what are the safeguards to that? Does it go direct? people just want to understand how you can do that. I think, Yassine, do you want to answer first? Because, yeah.
Sure. So again, it's important to look at the regulation and the law, and we design the technology accordingly. So the National Medicines Act is very clear on electronic and digital prescription. For an electronic prescription to be legal, an advanced electronic signature is required. What that means is that there is a particular technical process. There are certain accredited certificate providers that have to be integrated with the prescription system. There are a number of security processes. So the doctor has to undergo face-to-face verification. And furthermore, every script has a unique digital certificate. So that process for advanced electronic signature integration is required for a script to be legal. So what the law is very clear: either it's AES or it's a wet ink signature. There is nothing in between. And the healthcare professional can be held to account. In a medical legal instance, a script sent on WhatsApp, for example, is legally invalid. And there have been situations of recourse. So when EMGuidance went about building its system, we really toyed with various different solutions, but wanted to deliver something that met all the standards and kept healthcare professionals safe, primarily from a clinical and safety perspective, but then most certainly from a legal perspective as well. And so we provide a fully AES-driven system, and because of that, we've established SLAs with virtually all pharmacies nationally. So when you prescribe on EMG's system, it can, for example, pop up on the SCIM's dispensing system. Now, we give the patient the choice, though. So the patient, so it's a fully cloud-based system, firstly. The patient then receives a code, right? With that code, they can then select a pharmacy in the location, and the various partners that we have, which are now 98% of pharmacies nationally, will appear on the system, and then the patient then can click and then go and redeem the script at the pharmacy. And because of the security, the system also prevents pharmacy hopping. So once it's voided on the system, it's voided on the system. So I hope that should answer the question just in terms of the security. And sorry, on the scheduling, because digitally we can provide that level of security, we can prescribe right up to the top schedules. So our scripting solution is now very popular, particularly among psychiatrists who typically prescribe very high scheduled medicines because they can do it completely legally digitally through EMG.
Thank you, Yassine. Louis?
Yeah, so we have on a slightly different journey. Healthbridge at this point does not have the advanced electronic signature. And so what we do is we provide a mode where, in the end, the script is printed and signed in wet ink by the doctor, but at the same time, an electronic version is delivered to the pharmacy. And so what happens in this case is the patient needs to present the paper script, and at least on the pharmacy side, they can improve their operations and improve the patient experience because they can pick out the script and choose it from there. So we're respectful of the law, but we have to say that technology is advancing so much that the law is not keeping up. The principle and the right principle why AES is in place is to ensure that there's one copy of the script at any one point in time, and that it's secured, that it's not tampered with, and so on. The new technologies of the day ensure all of that without the need for an advanced electronic signature. But that is the law. Hopefully, over time, there are a couple of bodies that are thinking about approaching, the legal ambit and say, look, the spirit is right, but there are different ways to do it. So in the interim, as I said in the beginning, wet ink, print out, the electronic paper, the electronic version is there. Here's my script. I can see it on my system. Now you can have it for now.
Thank you, Louis. Last question, I'm going to ask Ellie. Ellie, you know, when you use your computer to record when you're doing a consultation, can you use the same computer to demo other things? So, for example, a speech therapist trying to demo something on their computer, can it record at the same time? Can it do, or do you need two separate equipment to do that?
No, you usually only need one, unless like we need access to the computer microphone. But as long as we have access to the computer microphone, you just need one device.
So you can work in the background while you're trying to use the computer to do other things.
Yeah, absolutely. You can move back and forth. You have multiple applications. And by the way, sorry to mention that, but I noticed we run out of like the free premium. I will add some more now. I just didn't expect that would be so many people signing up at the same time. So I will add some now. But yeah, to answer your question, you can use your computer for like as many, you can run as many applications as you want and still record it in ScribeMD.
Fantastic. So we've actually almost run out of time. I just want to thank our presenters for such fantastic presentation. I'm sure they've only shown a tiny little bit of what their platforms can offer. So please feel free to jump on then and try to explore some more. You can get onto their website. Ellie is the ScribeMD, Yassine is the EMGuidance, and Louis is the Healthbridge. Please go on their website and check out their product and just explore. I'm sure there's a lot more you can find. And if you have any questions, I'm sure you'll be able to ask those there too. So thank you very much for everybody who attended, and thank you for our speakers for spending the evening with us and sharing your expertise and your platforms. And please, we're going to post the poll so that you can post other questions that you want answered on the poll. And please, as many of you as possible to put it through to answer the poll questions. And thank you, everyone, for attending this evening.
Thank you, Caroline.
Okay, the poll is on the screen now. Okay, and thank you very much. I mean, it's been very, very informative, and these three are we believe are the ones that can probably change your practice the most in terms of the type of platforms that are the type of usage that's available. I mean, we're saying that we're not you know, there are many products on the market. We're not endorsing these specific ones, but we wanted to showcase the capability of all these different platforms. And these are South African based, so they are useful in the South African context, which is what we need. You know, because our demographics are very different to the demographics in the other countries. And obviously, you know, never mind the languages, but just the type of disease that we see, the type of patients that we encounter, and the needs within our community are very different to other countries. And so I think the ones that are based in South Africa within the South African context, probably the ones that are most useful to start with. Thank you, everyone, and good night.
Good night.